Good afternoon, everyone. I, Anjali, on behalf of the entire team of Saffron, extend a hearty welcome to all of you for joining in for the Liver Talk and enumerated expert clinical views on liver disease. As you know, today is International NASH Day, which is launched as a public awareness campaign around the world to raise visibility and urgency around the fatty liver disease and its more advanced form, that is non-alcoholic steatohepatitis, which affects more than 115 million population around the world. So in recognition of this campaign and International NASH Day, through our initiative Liver Talk, we aim to address and further enhance the awareness among the general public about NASH. And today we are very fortunate to have with us Dr. Lalit Shimpi, who is highly academic and inclined towards patient education. So I would now like to welcome and introduce Dr. Lalit Shimpi for today's session. Dr. Lalit Shimpi is a consultant gastroenterologist in Cedar Clinics, Pune. He's associated with various institutes like Dinanath Mangeshkar Hospital, Shayadri Hospital, Jahangir Hospital, MGM Hospital, Pune. Dr. Lalit Shimpi is an MBBS graduate of Pune University. He has received the award of the Best Outstanding Student of the Year in the third year of MBBS. He has completed his post-graduation in general medicine with a university gold medal from Shivaji University in 1997, and then he did his postdoctoral DM training in gastroenterology in 2002 from SMS Medical College, Jaipur. He has also done his DND in medicine and DND in gastroenterology from the National Board of Examinations. Dr. Lalit Shimpi then underwent hands-on training fellowship in ERCP and endoscopic ultrasound at the CBM University at Rome, Italy. His areas of interest include therapeutic pancreatic and biliary endoscopy and IBD. He has his OPDs in Jahangir Hospital and Dinanath Mangeshkar Hospital, as mentioned above, and he's also attached to Bharati Medical College and Hospital, Pune, as assistant professor in gastroenterology. With this, now I would like Dr. Lalit Shimpi to address the audience and take over the session. Thank you so much.
So thank you so much, Anjali, for the kind introduction. And as you mentioned, we are celebrating the World NASH Day today. And this is a good opportunity for people to get aware of this very specific disease which is affecting a lot of us, and this condition which is called as non-alcoholic steatohepatitis or NASH. So just to give a brief, I have a few slides with me which I would like to share. And if you can allow that, maybe I will share my screen so that it will be a little easier for everyone to understand also.
Yes, I have given you the access to the screen.
Yeah, so are you able to see the screen?
Yes, sir.
Yeah, okay. If any problems in the network comes, please let me know or call me, and then I will reconnect. So sometimes the network gives an issue. Okay. Anyway, so I have a few slides, and what we'll discuss today is something called as NASH. For the common person, this is also something which is designated as fatty liver. And we do get a lot of patients who come to us with ultrasound report or sonography report saying that they have a fatty liver. Many times this is done for certain GI symptoms, or sometimes it was also detected when a patient goes, for example, for some other issues like a gynec issue, and an ultrasound is done and incidentally you find a fatty liver on the ultrasound. So it's more of a diagnosis which is found on sonography, and then the patients are directed to specialists or to gastroenterologists to get their opinion. So what is basically this fatty liver? Fatty liver is, okay, let me see. Yeah. So fatty liver is very simple. It's defined by the presence of fat in more than 5% of the liver cells. So normally liver cells do contain some fat, but it is not in excess. But once this becomes excessive, it is called as fatty liver. The most common cause for fatty liver in our country is alcoholic liver disease. So if someone is consuming more than say a drink per day or is a chronic alcohol ingestion history is there, then these people have fatty livers. But what is more and more commonly nowadays seen in our practice is something which is called non-alcoholic fatty liver. So the person is not consuming any alcohol, but still he or she has a fatty liver seen on the ultrasound. This is getting more and more common in our practice, where we see a lot of our patients, especially ones who are diabetic or patients who are obese or are overweight, and these people come to us with fatty liver disease. So it is quite prevalent, and in fact, up to 7 to 10% of population, general population, has fatty liver disease. And if we see the number of diabetics or the number of patients who have a higher BMI or in these cases, or they are fat or obese, then these are the people who in whom fatty liver is present in more than about 50 to 70% of people. So it is quite a common phenomenon. There are various risk factors for fatty liver disease, and they include a higher age, female sex, high body mass index or BMI as we call it. Then there is this something which is very unique to Indian population called central obesity. Means you are not, a person may not be really looking fat, or their weight may not be high, or they may not be obese, but they have central obesity. Means their stomach is or their belly is large, and it is because of fat deposition they have a odd belly, and though their weight may be normal, they still have central fat deposition, which is more dangerous to cause fatty liver. As I mentioned, in diabetics have a lot of fatty liver disease, and those who have hyperlipidemia or high cholesterol levels in their blood, they also have commonly have fatty liver disease. So when you have just fat deposition without any damage to the liver, it is called as NAFLD, or non-alcoholic fatty liver disease. But when there is some inflammation in the liver, and the liver is the liver cells are inflamed and it is causing some damage to the liver, then it is called as non-alcoholic steatohepatitis, or NASH. So what we are describing today in our or what we are celebrating today or increasing awareness is for this NASH, or non-alcoholic steatohepatitis, because once you have some inflammation in the liver cells, then that can progress to more serious liver problems. So if we see the prevalence, especially in high risk groups, as I mentioned, about 60 to 90% of people who are obese or who are overweight will have this non-alcoholic fatty liver disease, out of which about a third will have inflammation in the liver and they will have some damage. If we similarly see diabetic people, 60 to 80% will have fatty liver, and out of that, again, about 20 to 80% may have NASH or may have inflammation. But as hepatologists or as gastroenterologists, we tend to see only the tip of the iceberg, where people who have got their ultrasounds or have got imaging will come to us with a report of a liver function test, which shows some increased liver tests, abnormal liver tests, or they will come to us with ultrasound reports saying that they have fatty liver. But it is a universal problem. Unfortunately, India being the diabetic capital of the world, there are so many diabetics in our country that we are really in a high prevalence zone, where the prevalence of this NASH or fatty liver may be as high as 30 to 50%. In India, if we see, there have been various studies from north, south, east, west, and most of the times we have seen that the incidence among general population is around 10, 20 to 30%. Now, as I said, in Asian people, unfortunately, our metabolism is such genetically that we tend to have more of central obesity, and we tend to have people who have fat deposition around the belly rather than being overtly fat. So our BMI, which should be normally less than 23, BMI is calculated as weight upon square in meters. So if you have central obesity, then that is more dangerous for fatty liver. uh, it is not that fat people will have fatty liver and that will cause more damage. In fact, the people who have leaner and smaller or normal BMIs, but who have central obesity are the ones who are at more risk for developing more serious liver diseases. So as I said, this fatty liver disease is just not, it is basically a metabolic disease. So your body cannot uh, take care and metabolize fat very properly. And that is why this fat gets deposited in various organs. So that may be in the blood vessels, like we see cholesterol deposition in the blood vessels, which can cause heart disease, which can cause stroke. If the same fat gets deposited in the liver, it causes fatty liver. And it is commonly associated with these other conditions. And especially people who are diabetics, who are obese, who have high cholesterol, who have high blood pressure, these are the ones who should be investigated and found out whether they have fatty liver, because all of these diseases form a group of problems which is common, and most of the times it is because of some metabolic abnormalities like resistance to the effect of insulin, which is one of the main hormones in the body. So this fat, when there is overload of fat in the blood and in the metabolic cells of the body, then it goes and gets deposited in the liver, or it can get deposited in other organs and cause problems. So you have some good cholesterol, you have some bad cholesterol. So when triglycerides or cholesterol and fatty acids, these bad kind of cholesterols get deposited in the liver and other organs, it causes fatty liver. Why are we worried about fatty liver disease? Because it is known to progress to more serious problems. So if you see this diagram on the left, you have a normal liver. Then you have a little yellowish appearing liver because of deposition of fat. So if we don't treat this in time and don't take care, then it may lead to fibrosis or more permanent damage and scarring, and ultimately it may lead to cirrhosis. So you might have heard about liver cirrhosis. Basically, when the liver gets completely damaged, fibrosed, contracted, nodular, then its function is lost and then complications start happening. People can develop liver cancers or can develop liver failure. And this NASH or fatty liver disease is today one of the most common causes why people develop cirrhosis. And that is why there is an urgent need for all of us to be aware of it. So what do we do to treat this fatty liver? Uh, the most important thing is to have a healthy lifestyle. So if you follow good diet, if you follow good exercise schedule, then most of the times this fatty liver can be taken care of, and the inflammation what is there in the liver can be reduced. There are also treatments which are available, like for example, there are certain medications which are used, and these can also lead to reduction in the fat and reduction in the inflammation. For people who are morbidly obese, means their BMI is more than 35, 40, those are the patients who sometimes get benefited by doing bariatric surgery, and the fat deposition reduces once they get bariatric surgery and they lose significant weight because of the surgery. But there's no need to jump for bariatric surgery because most people only diet and exercise is the best solution. What do we do as far as diet is concerned? So you should limit your caloric intake. The most important thing, like for example, you are having three chapatis, rice, outside food, processed foods. Then what you need to do is to reduce the calories. How can you reduce calories? You can reduce the calories or food that should be taken. So one should avoid, let's say, for example, junk foods which contain a lot of refined flour, like pizzas, pastas, corn flour. These are things which can give rise to more abnormal metabolic factors in the body, and they are more harmful. Then you have fructose containing sodas, artificial juices, sweeteners, cold drinks. So these are things which are bad for the liver, bad for the metabolism, and that is something that you need to avoid. So what we recommend is a hypocaloric diet. Whatever amount of diet that you're having in the day, you can calculate that and try to reduce that by about 20%. And if you can specially reduce the fats or the oily food or high fat containing diet, if you're having non-vegetarian food, red meat is something that you can avoid because it has a lot of calories and fats, saturated fats, lot of oils. So these things, if you can reduce. In addition, you also reduce refined flour, you reduce the amount of sweet stuff that you are taking, refined carbohydrates, that also contains a lot of calories. So the main thing is to reduce calories in your diet. If you do that, then a lot of times it improves the metabolism like it. Then what is the second step to do is to do good regular exercise. So at least 45 minutes to 1 hour of good aerobic exercise along with some weight training is what is recommended for as exercise to improve the body's metabolism. And if you can do this at least 3 times or 4 times in a week and reduce your weight. So what both of these things will do, your diet as well as your exercise, they will reduce your weight, they will improve the metabolism, and they will reduce the inflammation which is happening in the liver, and that leads to sustained weight loss. So lot of times this is easier said than done. So how many people will be able to sustain a good weight loss, say more than 3 kgs? Many people. But as you go higher, weight loss of 5%, 7%, 10%. So if you're 80 kgs and you want to lose 8 kilos, that is 10%, then very few people will be able to sustain that. But any amount of weight loss will help your metabolism, will help the fatty liver. So if you lose at least 3% of your weight, then your steatosis or fat deposition will improve. If you can lose more than 5 to 7%, then that inflammation in the liver will reduce. And if you can lose more than 10%, then the permanent damage which is happening in the liver, that can also be taken care of. So many people are able to achieve 3 to 5% weight loss just with weight and with weight reduction, diet control, and exercise, and that also helps. But it most of the times will help if you can, if you're especially if you're high BMI or obese or overweight or fat, then you should reduce at least 10% of your body weight, not drastically, not by going for very severe kind of dieting fads or trying to reduce 5 kgs in 1 month and 2 months. Don't do that. Gradually over 1 year or so, one should try to reduce weight gradually so that the body's metabolism improves, your body also get used to it. And the more faster you lose weight, the more less sustained it is. So if you manage by some means to lose 5 kgs in 1 month, it is very unusual that you will able to maintain that. Once you achieve a more gradual weight loss and your body gets used to it, used to the diet that you're following, to the exercise schedule that you're following, then you don't have that craving coming back for food even after you have lost weight, and that is more sustained. So that is something which definitely helps. Of course, there are doctors to help you and there are medicines to help you. So there are liver protectives which can be prescribed. Antioxidants like vitamin E is known to help. Coffee has good amount of antioxidants, so that helps for a lot of people with fatty liver. And then if your cholesterol levels are high, then you can be given certain medications to reduce the triglyceride or cholesterol levels in the body, and that helps for the body's inflammation and the liver inflammation reduced down. Of course, as I said, for a subgroup of people who are extremely fat and obese, bariatric surgery may improve a lot of these parameters, including fatty liver. But as I said, the best way and the most effective treatment for fatty liver is to concentrate on a good diet and concentrate on regular exercise. And if you can do that, most of the times, the permanent damage to the liver is avoided. The inflammation in the liver reduces down. So this is what is going to help. So if you do your repeated ultrasound, then you still keep on showing fatty liver, but the severity of the liver damage is what, as gastroenterologists or as liver specialists, we are more concerned of, and that is the reason that we advocate that all people should follow a good diet, follow good exercise schedule, and that will take care of this problem, which is day by day increasing in the world and causing more and more health problems. So I think this is as far as my presentation is concerned. So thank you very much for a patient hearing. And if there are any questions, I will be glad to take care of them and answer them for your benefit. So any questions are welcome. I'll hand over back to Saffron. A special thank you to Saffron Formulations and Aries Pharma for this arranging this FB Live program. Back to you, Anjali.
Thank you so much, sir, for a very elaborate presentation on NASH. So one thing regarding the Indian population, most of the patients are actually obese initially. So like for them, how often do you recommend getting their liver test done?
Generally, for people who are diabetics or at high risk or those who are obese, one should check their liver function test. So the ultrasound you can take it, you can get it done only once. Once you know that you have fatty liver, you need not repeat the ultrasound just to see whether it is grade 1 or grade 2 or grade 3, because that doesn't really make a difference. What makes a difference is the liver function test. So if they are abnormal, then we advocate all of the patients to do their liver function test every monthly till they come back to normal. And for the general population, you can do your liver function test every year as a part of an executive checkup. Most of the times now, many of the corporates are doing their employees tests every year, which is good enough. So as long as they are remaining within normal limits, every year is also good enough for more people. If you are at higher risk, for example, you're diabetic or you're having hypercholesterolemia, then maybe every 6 months also may be adequate.
So although there are medicine recommendations, but there is no proven therapy for NAFLD. So any recommendations on how the patients can make their life easier who are already going through the liver disease?
So as I mentioned, a lot of these diet plays a really major role. Exercise plays a major role. And if you can lose weight, that is the most sustained kind of improvement that you will get, because you're just not concerned about fatty liver. Those who are having fatty liver many times also are diabetic, many times are also hypertensive. They are prone for heart disease. They are more prone for strokes. So what you need to do is to improve your metabolism. Once your entire metabolism improves, then there is a much better chance that over long term, over the next 10 years, 20 years, 30 years, you will not be at risk of developing any of these other complications that come with fatty liver. So that is as important as this is. So medications, I would say they are kind of the last ditch kind of something that can be done for people who don't respond to diet and exercise. But I think these two form the main portion or part of the management.
Okay, sir. One take-home message, sir, on the occasion of International NASH Day to all the patients as well as the general public.
I think healthy lifestyle is what is the really take-home message. And I think if you can do that and manage that, a lot of people will over the years kind of be healthier. And this is very typically a very lifestyle disease which has come over the last 10, 20 years. It has really increased because our lifestyle has changed. It has become more stressful. We are more our food habits have really changed. The kind of Indian traditional diet that we used to have is being less and less consumed, especially by youngsters, and we do see a lot of young people. So I think healthy lifestyle, that is what is the really take-home message.
Thank you so much, sir. With this, we come to an end of this today's session. So on behalf of the entire team of Saffron, I, Anjali, extend a vote of thanks to Dr. Lalit Shimpi for joining us today despite his very busy schedule and guiding us about a silent epidemic known as NASH. So with this, I would also like to thank our audience who have joined us this afternoon and helped us taking this initiative further. So Dr. Lalit, I would like to thank you for your guidance over the NASH, and we look forward to your support in the further initiatives as well. Thank you so much, sir, for joining us today.
Thank you so much and have a good day.
Thank you.